my name is Sophia Simpkins. I'm the VP of Political Education for the Vermont Federation of Nurses and Health Professionals. We're here today to march against the cuts. UVMC has spread misinformation that most of the cuts are administrative, but in fact they're only eliminating a small portion of what they said they're eliminating from administration, and they're cutting a lot of our members' jobs who provide direct patient care, including primary care nurses like myself. 2 clinics were slashed 50% of their nurses. So we're here to rally and speak out and educate the public about this today.
So where are you going from here?
We will be marching down to City Hall Park, where we'll be giving some speeches and having some ice cream from Ben & Jerry's, and hopefully getting to speak to members of the public about what's going on.
And do you have allies? Do you have allies through your union or your area?
Yes, we have multiple locals, both part of AFT Vermont and across the state, who are standing with us against these cuts, because they know how important it is for Vermonters to have good health care, especially access to primary care.
Hi, my name is Nicole DeVita. I am the president of the Vermont Federation of Nurses and Healthcare Professionals. We are here today for a march and rally for both the VFNHP and Support Staff United as we bargain together our contracts. Some of our key priorities for bargaining is safe staffing, healthcare for all, and livable wages, along with immigrant rights, our workers' rights. So we are here today to engage the community in our fight with the hospital and the network to bargain a fair contract. Recently there have been cuts to staff. When we're already in a staffing crisis, we cannot afford any additional cuts to staff. They have been the hospital and the network has made it seem like the regulators who have asked the hospital to cut expenses, that it is appropriate for them to cut at the patient care level, which it is not. Those regulators have asked the hospital and the network to cut administrative and overhead expenses, not clinical services. We have recently had cuts to primary care staff, as well as a lab closure, which sends healthcare dollars out of the state of Vermont and contracts them out to Florida. So we are here today to say enough is enough, that the hospital and the network has to live up to its mission of providing high quality patient care, and we cannot do that with less. So we need to address the staffing shortages. We need to address the right for health care for all, to have an affordable health care system, and to address the fact that people need to be able to live and work in the state of Vermont. So we're here to build a better, stronger, and healthier Vermont.
And so who are your allies? Who are you working with? Do you get support from the doctors? Do you get support from the community? Where do you get your support?
Well, we are building our support through the community. One of the organizations that we have been working with, as I mentioned before, how it is we are fighting for immigrant rights, our worker rights, and we are also asking the hospital, we have asked the hospital through a proposal to purchase milk with the Milk with Dignity program. So we have been working collaboratively with Migrant Justice recently as well, and formed a great partnership with them, because as everybody knows, a lot of the farmers are not a lot of those organizations have not been given their workers the same benefits as other workers, so we're fighting that for immigrant rights, or workers' rights as well.
So right now you're going to rally together, you're going to march to City Hall, is that what you're doing?
That is correct, yes, yes.
Okay, so you're going to have speakers there?
We're going to have speakers there. We're going to talk about the recent cuts. We're going to talk about safe staffing. We're going to talk about cuts that have been made to our own health insurance as well. So we're hoping that the community is listening, is aware, and is prepared to help us keep up the good fight.
Hi, my name is Nikhil Goyal. I'm a candidate for Vermont State Senate. I'm really proud to stand in solidarity with the healthcare workers who are demanding a fair contract. It's time for the UVM Health Network, for the Medical Center, to put the needs of patients and healthcare workers ahead of profits. These workers deserve fair wages, good benefits, and decent working conditions, and I'm proud to stand with them in their fight for justice in their workplaces.
Oh, sorry.
We win! 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 We win!
When patient care is under attack, what do we do?
Stand up, fight back!
When patient care is under attack, what do we do?
Stand up, fight back!
When patient care is under attack, what do we do?
Stand up, fight back!
When patient care is under attack, what do we do?
Stand up, fight back!
Patient care is under attack, what do we do?
Stand up, fight back! Human rights!
Healthcare is a human right. Healthcare is a human right. Healthcare is a human right. Healthcare is a human right.
Patients must unite!
Healthcare is a human right.
Workers, patients must unite!
Healthcare is a human right.
Workers, patients must unite!
Healthcare is a human right.
Workers, patients must unite!
Healthcare is a human right.
Workers, patients must unite!
Healthcare is a human right.
Workers, patients must unite! Workers, patients must unite!
Reality check. Healthcare is a human right.
When patient care is under attack, what do we do? Stand up, fight back! When patient care is under attack, what do we do? Stand up, fight back! When patient care is under attack, what do we do? Stand up, fight back! When patient care is under attack, what do we do?
Stand up, fight back.
Yeah, they've healthy living been just voted.
Stand up, fight back. Stand up, fight back. Review and help with severe as needed, and then. We don't know.
They said my tent. Pardon me.
right now to thank the Quakers for giving us this space, and we would like to take...
Turn up the volume.
We're going to take a moment of silence. Okay.
There you go.
How about that? All right. Well, I was saying we're going to take a moment of silence to think about peace and to appreciate our Quaker friends for giving us this space. All right. It is so incredible to feel the community behind us. As I said before, UVM Medical Center is making cuts to patient care. In my own department, they laid off an exemplary worker who had been with us for 6 years and just expected me to pick up her work. And I know that's happening happening all across the hospital. We are missing coworkers, missing positions, and being told, do the work, get it done. We know that there's less of you, but we're just gonna say, it'll be okay. We're right-sizing the work. Next, we're going to hear a story from Tegan Cook, who works in HEMONC, about the impacts of short staffing on their department. Tegan? Come here.
All right, getting my port. I turned it off. Hello? There we go. Future speakers, please be aware there's a very sensitive mute button on this mic. Hi, my name is Tegan Cook. I work in the Cancer Center at UVM, helping to schedule cancer treatments for patients. When a patient comes to our clinic, it's one of the scariest times of their lives. They're getting screened and potentially diagnosed with cancer. The scheduling team is there every step of the way with our patients. We arrange their first appointment, we schedule their follow-up appointments, we coordinate across other departments and other providers. We arrange their first appointment, schedule follow-up appointments, and coordinate across other departments and providers to schedule things like scans, biopsies, or other coordinated care. Our department sees hundreds of patients every single day. We have 13 schedulers to process the post-appointment instructions for care. We don't have enough staff to keep up, and it's been that way for way too long. It's not a matter of if a dangerous patient situation happens. It's a matter of when. Recently, a patient needed to have a bone marrow biopsy. Because there are not enough schedulers and we're working through an increasing backlog, this patient missed the time frame for the procedure. Our understaffing has repeatedly led to worse continuity of care and delayed care. The number of near misses that are happening are staggering for our team. We're terrified of taking time off. There's no one to pick up the work, and patient care falls even further behind. Our patient numbers are expanding steadily. More patients are being diagnosed per capita, and the people that are diagnosed are living longer, which is great because the treatments are working. But it does mean that our patient load is growing without any increase in staffing. We've had multiple meetings with our supervisors, our providers, and only after months of dodging and ignoring us, finally with our assistant vice president, nothing has changed. The fact is, with our patient load, there are not enough hours in the day to even tread water. We are losing ground. We feel that we're failing and betraying our patients constantly. We cannot give them the care that they need and deserve. We cannot coordinate so that they can see their grandchild's first birthday, which might be the last one that they're around for. We don't have the staff. We don't have the time. We don't have the time to train people sufficiently for the amount of turnover that we have, which results in more turnover due to the lack of training. Almost all of us work through our lunches and other breaks. We're calling on UVMMC to fulfill our first responsibility, as stated in the preamble of our contract, to provide safe, quality health care to all patients. We need more full-time employees as soon as possible and the time to thoroughly train them. We need an efficient and accountable path to safe staffing grids, not those stupid committees that they keep pushing us to do that take 10 months for nothing. And we need that so that as soon as needs in the clinic change, staffing keeps up. We need clinics that have enough staff so as to not cause someone like me to go to the ER 3 times in 1 week due to the stress of understaffing. And I know that's not helping y'all in the ER out either. We're here for the Cancer Center. We're here for all outpatient areas and for all of UVMMC. We need safe staffing now.
Thank you so much, Tegan, for that really important story and context. And for anybody who doesn't know, we did a bargaining survey before we started bargaining. And even in these incredibly tough economic times, safe staffing was our #1 priority. Because we are the patients. Next up, we're going to have Mike Popovich speak to our healthcare situation.
Hi, everyone. I know everybody here, most of you probably know me as Poppy, but my name is Mike Popovich. I'm in my 20th year at the hospital. I'm here today to talk about something that's about far more than just a medication. It's about whether the organization, UVM truly values the health and well-being of its employees. It's about whether those values only apply when they're convenient to the hospital. I've been battling with my weight since I was about 14 years old, and while I will not go into the entire history of the challenges it has placed directly in front of me for decades, I will mention that the challenges have been many. From ridicule to personal image issues as a young man, and the weight stigma has caused anxiety, depression, discrimination, and many other issues that have contributed to having to mask my personality and struggles with my mental health. It has, in my adulthood, caused issues with cholesterol, high blood pressure, chronic back, hip, and knee pain. My issues with weight have not been easy to deal with. From yo-yo weight loss and gain, from fad dieting that I thought would finally become the answer for me, to exercise routines that turned out to not be the answer, to pills and shakes that promised things that would never deliver on. All of these things have led to a stage in my life where nothing worked anymore. Nothing. Do I have a relationship with food? Yeah, everybody here does, I'm sure. Thank you. But then I found something that would help, something that actually saved my father's life. GLP-1. I was hesitant, but I had to try something because no matter how much I was exercising or how much diet restriction I put on myself, I was still gaining weight. 18 months ago, I was 320 pounds. I didn't have a choice, I needed to try. I sit here now at 270 pounds. Finally below my healthy weight days as an aspiring college athlete. This medicine turned off all the noise in my head. It did the things it was prescribed to do for me. And for me, it is a miracle. And now, UVM wants to rip it away from us. For what? So they can save a few bucks? To be clear, I am angry about this. I'm sure a lot of us here are too. Across UVM our fellow co-workers and their families have found something that has finally changed their lives. After years of struggling with obesity and chronic diseases that often come with it, many like me have found treatment that works. They've lost weight, they've lowered their blood pressure and blood sugar, they've reduced their risk of heart disease, they've improved sleep apnea, joint pain, mobility, inflammation. Many have been able to reduce or eliminate other medications. They've become healthier patients, healthier parents, healthier spouses, healthier coworkers, and healthier people. Most importantly, they have found hope. And now with one corporate decision, that hope is being taken away from us. We're being told that this is about saving $19 million. But where's the analysis of what the decision is actually going to cost? What happens when our members who successfully manage chronic disease are forced to stop treatment because they simply cannot afford these medications on their own? What happens when the weight comes back, as the evidence tells us it often does when treatment is discontinued? What happens when high cholesterol returns, blood pressure rises, sleep apnea worsens, heart disease risk increases, joint damage accelerates, and people once again need more medications, more specialist visits, and more hospitalizations. These costs don't disappear. They're simply pushed into the future where patients eventually our healthcare system will pay an even higher price. But there's another cost that can't be measured by their precious spreadsheets: the emotional toll. Myself and many of our coworkers have spent their entire lives being judged because of their weight. They've tried every diet, every exercise program, every fad, every medication that was available. They blamed themselves because society told them obesity was simply a lack of willpower. That science has finally caught up. These medications gave people back control of their lives and their health. They've given people confidence. They've reduced anxiety. They've improved depression, and they've allowed people to believe that a lasting change was finally possible. Now, UVM is telling them that progress has a price tag. And it's one thing that they're no longer willing to pay. Do we agree with them? No! Let's be honest about what this message actually sends. It tells employees living with obesity that their chronic disease is somehow less worthy of treatment than others. It tells them that evidence-based medicine is available for some, but not for all people who dedicate their lives to caring for those patients every day. As a healthcare organization in public, they stand up and they proudly puff out their chests and talk about prevention. They encourage our patients to manage chronic disease before it becomes too severe. They celebrate innovation. They claim to put people first. Well, we are people too. So why are we doing the exact opposite for our own employees? If we truly believe obesity is a chronic disease, as every major medical organization now recognizes, then we are singling out one of the most effective treatments available. Why are they choosing to save money by taking health care away from the people who make our hospital and our community healthy and functionable? This isn't just a benefits change. It's a decision that will affect the health of our coworkers, their spouses, their children, and their families. It will affect their finances, their mental health, and their futures. We deserve better than this. Tell UVMMC to stop the cuts and invest in our community and our coworkers.
Thank you so much, Poppy. Next up, we are going to have a speaker from our very good friends at Migrant Justice. Who got the power? We got the power. Who got the power? We got the power. What kind of power? Union power. Sí se puede. Sí se puede. Sí se puede. Sí se puede. Hola a todos, mi nombre es Telma y soy parte de la comunidad migrante aquí en Vermont.
Hello everybody, my name is Telma and I am part of the immigrant community in Vermont.
Estamos aquí en solidaridad porque reconocemos que la lucha de la clase obrera no conoce fronteras.
And we are here marching in solidarity with you because we know that the working class struggle knows no borders.
Estamos aquí en solidaridad porque sabemos lo que están pidiendo, sabemos de las condiciones y estamos con ustedes.
And we are here marching in solidarity because we know what you are demanding. We know the conditions you're facing and we know what you're fighting for.
Reconocemos el trabajo que están haciendo y todo lo que están luchando no solo por ustedes, sino también por nuestra comunidad.
We recognize the fight that you have on your hands, and we also recognize that you are not only fighting for yourselves, but you are fighting for us as well.
Sabemos que dentro de su contrato también están pidiendo leche con dignidad, están pidiendo un bien común para nuestra comunidad.
You are fighting, you are standing for the common good. And among those common good demands is the demand for milk with dignity.
Sabemos que también la comunidad migrante que trabaja en ranchos se enfrenta a malas condiciones y por eso es importante y reconocemos el papel que ustedes juegan en este momento con lo que están haciendo. Desde los ranchos, la voz de nuestra comunidad está aquí con ustedes en solidaridad.
Because just like you, immigrants on dairy farms across the state are fighting for their dignity, standing up to mistreatment. And so our fight is one, and we need to get each other's backs.
Tenemos que hacer responsable de quienes se lucran con el trabajo de todos nosotros. Es imposible que como seres humanos sigamos permitiendo este trato inhumano. Con esos precios que hay, ni siquiera se puede sobrevivir. Estamos hablando de un trato humano hacia la salud.
Because we need to stand up and stand united to hold accountable those who are profiting off of our labor. We know the prices that they are charging for the health care that you all provide. We know that they are making it impossible for people to afford this care, and that's not right. And we know that you all as workers are not benefiting from those prices.
Entonces, Leche con Dignidad, como lo mencioné hace un momento, es un programa que hemos creado en la comunidad de trabajadores para cambiar la industria y todo lo mismo que ustedes, ¿verdad? Hay alguien que se beneficia con el trabajo de la comunidad. Entonces, Leche con Dignidad ha traído mejores condiciones en los ranchos para los y las trabajadoras que están ahí.
So Milk with Dignity is a program that farm workers have created to protect our rights in the workplace. Just as you all are fighting for fair treatment, that is our fight on the farms, and that is what we are doing, transforming the dairy industry through Milk with Dignity.
Ha sido también una campaña importante y un logro importante para nosotros. Nosotros llamamos el nuevo día porque hay gente que está experimentando mejores condiciones. Ben & Jerry's fue una de las compañías primera en firmar el contrato y sé que hay muchos que están probando el helado y pues sabe rico, ¿verdad? Sabe rico no solo por el sabor de la fruta ni de la leche, pero el sabor que tiene la dignidad.
And so through Milk with Dignity, we are bringing about a new day for human rights in the dairy industry. We are winning the changes that we seek. Ben & Jerry's is one of the first companies to join the Milk with Dignity program. And I see many of you right now are tasting that Ben & Jerry's ice cream, and it tastes good, right? And that's not just the taste of the ingredients, that's the taste of dignity, the dignity that the farm workers are experiencing.
Por eso estamos aquí, porque sabemos que solo cuando nos unimos y luchamos podemos lograr cambios muy importantes para las comunidades.
Because it is only when we fight together that we can win these important changes for our communities. We're going to say, get up, get down, Milk with Dignity's coming to town. Get up, get down, Milk with Dignity's coming to town. Get up, get down, Milk with Dignity's coming to town. Get up, get down, Milk with Dignity's coming to town. Get up, get down, Milk with Dignity's coming to town.
University of Vermont Staff United, Ellen K. speak.
Good afternoon. Good afternoon. Can everybody in the back hear me? Okay, I saw that. Did we all come down here on a Sunday to march and rally together with these workers? Yes! You are sure. Does this mean that we are organized? Yes! Does the boss like it when we're organized? No! Then let's keep that up, right? So I'm Ellen K. I'm a proud member and co-president of University of Vermont Staff United. We are 1,500 staff, all kinds of workers at the University of Vermont. And I come here to stand with the healthcare workers at UVMMC. UVM Staff United stands with the support staff wages. Many of our colleagues work side by side with UVMMC workers. Workload and safety issues like we've heard about today have a direct effect on our workers too. How many of us access our health care through UVMMC? We're here in solidarity with these unions in their fight for safe staffing, which is really a fight for the soul of health care in Vermont. Now, the only way to profit from health care in Vermont, due to our small population, is cutting care and staffing that people need. We're here to say that health care for profit is immoral. We need all of our unions fighting together for universal single-payer health care. And we are grateful to the UVMMC unions who are paving the way and modeling for the rest of us what we have to do. UVMMC unions are fighting for all of us to have access to health care, for healthcare workers to be treated with dignity as they provide health care to Vermonters. Will we stand with them? We say to the UVM Health Network, healthcare workers keep us safe. Invest in them, not in high-paid administrators, outside contractors, and outsourced corporations. And when we organize and fight back, we are teaching the community how to do it. And when we fight back, we win. When we fight back, we win. When we fight back, we win.
Thank you so much, Ellen. Thank you so much to everybody that joined us today, our friends with the DSA, with Mayday Strong, with UVM Staff United, with Migrant Justice, Ben and Jerry. We cannot do this without you because we are doing this for our community, as our community. And next steps are going to be showing up strong to our next bargaining sessions. They are not going to concede an inch without us showing our power and how organized we are together. And this is an excellent first step. Thank you so much all for being here. Oh yeah, to help us close out, one of our lovely friends from the Medicare Nonviolent Army, Medicaid, Keith.
Hey everyone, my name's Keith Brunner. I live in the Old North End. I'm a member of the community, and I just want to lift up this union who's been fighting for health care for all of us for over 15 years. Let's give a round of applause for all of us here. So this is a call and response song to kind of lead us out. It goes, y'all ready to follow me on this? Okay. What do we want right here today?
What do we want right here today?
Healthcare for our people.
Healthcare for our people.
We're marching till we get our way.
Marching till we get our way.
Healthcare for our people.
Healthcare for our people.
What do we want?
What do we want?
It's healthcare. Here we go. What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want right here today?
What do we want right here today?
Safe staffing for our patients.
Safe staffing for our patients.
We're marching till we get our way.
Marching till we get our way.
Safe staffing for our patients.
Safe staffing for our patients.
What do we want?
Safe staffing.
When do we want it?
Now.
What do we want?
Safe staffing.
When do we want it?
Now.
What do we want right here today?
What do we want right here today?
Fair contract at the hospital.
Fair contract at the hospital.
We're marching till we
All right, y'all. Thank you again for being here, and can't wait to see you at the next bargaining session on Wednesday.
Hi, I'm Sarah George, Chittenden County State's Attorney. I'm down here at a rally for union support for our nurses. I'm from a family of nurses, and I understand very, very well the importance of safe staffing, livable wages, and making sure that our patients have all the care they need and are being provided that care by nurses that are taken care of and by an administration that cares about them. So calling on UVM to come to the table and make sure that we give our nurses everything that they need to give our patients care and to bring this community together in a way that we all need. And I'm really thrilled to see all of the different unions here today representing and helping to support UVM Medical Center. I think that when we all come together, we're all better.
Thank you. See you next time.